Leonae. I'm going to be your nurse today. What's your name and date of birth?
Benaria White, June 17th, 1996.
Great, that matches your armband. I'm just going to check your chart over here. Okay, everything matches. I'm going to close this curtain for a little bit of privacy, and I'm going to wash my hands. Why are we here today?
I'm here for a head-to-toe assessment.
Okay, great. What's the date?
Today is the 19th of April, 2017.
And do you know where we're at right now?
The College of Nursing.
Yes, that's correct. So this patient is alert and oriented ×3 to person, place, and time. So the head-to-toe assessment is very hands-on. I'm going to have to touch you. If you feel uncomfortable at any time, just let me know and we'll stop, okay? So I'm going to start with your head. I'm just going to start palpating and inspecting your scalp. The cranium is symmetrical. There's no masses, no lesions. The hair seems to be distributed evenly. There's no signs of baldness. It's thick and full and not brittle. So that's great. I'm just going to go ahead and feel your temporal pulses. They're equal bilaterally and 2+. Your eyebrows are full. They're symmetrical. Your eyelashes are thick and full and evenly distributed. The sclera is white with no signs of jaundice, and the conjunctiva is pink and moist. Okay, now we're going to assess for perla. I'm just going to have you look at the wall, okay? I'm going to shine this light into your eyes. Great. All right. Now I'm going to have you continue to look at the wall. Now focus on my finger. All right, that's great. So the eyes are perla. They're equally round and reactive to light and accommodation. Now I'm going to test the 6 cardinal fields of gaze. I'm just going to have you watch my pen with your eyes only, not your head, okay? All right, great. So her eyes followed my movements perfectly. Now I'm going to go ahead and palpate for the lymph nodes. Let me know if you feel any pain, okay? I feel no masses, no palpable lymph nodes. Do you feel any tenderness? Okay, great. Now I'm going to palpate your sinuses. Let me know if there's any tenderness. No tenderness? Okay. I'm just going to go ahead and feel your ears. They're symmetrical in size and shape. They don't have any lesions or masses on them. Did you feel any pain when I touched them? Okay, great. Now I'm going to go ahead, and even though she's communicating with me and she seems to understand everything I'm saying, I'm going to go ahead and do a little extra hearing test. I'm going to rub my fingers next to her ear, and you're just going to tell me when you feel it, when you hear it, okay?
I hear it. I hear it.
Okay, great. So now I'm going to move on to the nose. I'm going to check for patency. Go ahead and put a finger like that. Okay, and breathe in and out. Great. So the airway is unobstructed. Tilt your head back for me. Okay, the nares are not too moist, not too dry. I'm going to go ahead and have you open your mouth. Okay, the oral mucosa is pink and moist. The tongue is pink and moist. All the teeth are intact. Go ahead and say ah.
Ah.
The uvula and soft palate rise, and they're both midline. Okay, everything looks good. It looks like she performs proper oral hygiene. Now we're going to go ahead and do facial movements. Okay, I want you to copycat me, okay? Raise your eyebrows, pucker up, puff your cheeks, smile really big, stick your tongue out and move it all around. Okay, facial movements are all symmetric and equal on both sides. Now I'm going to go ahead and move down to the neck. I'm going to check that your trachea is midline, and it is. I'm going to feel each carotid pulse one at a time, and I feel it. And they are equal bilaterally. Now I'm going to do jugular distension. I'm going to have you lean your head back. There's no distension of the jugular vein. Okay, great. Now I'm going to go ahead and auscultate her carotids for any bruits, and I'm going to do that with the bell of my stethoscope. There were no bruits in my patient's carotid arteries. Okay, now we're going to move on to the chest, and I'm just going to assess her respiratory rate. It looks like she's breathing fine with not a lot of effort. She's breathing at 12 to 20 breaths per minute. The rhythm is even. It's nice and slow, not too slow though. So I'm gonna go ahead and auscultate anteriorly for respiratory sounds with the diaphragm of my stethoscope. So I want you to just breathe normally, okay? Okay, great. I'm going to have you lift your arms up like this, and I'm going to listen for lateral breath sounds. I'm just going to move over to this other side. Okay, great. I'm going to have you turn that way. And I'm going to listen to her breath sounds posteriorly. Go ahead and breathe in. Okay, so stay right there for me. There were no adventitious breath sounds. Her lung fields all sounded clear. I didn't hear any signs of wheezing or rhonchi. Now I'm just going to go ahead and palpate her back for any masses or tenderness. Let me know if you feel any tenderness, okay?
No tenderness.
Okay, great. Now I'm going to check for thoracic expansion. And have you take a deep breath in for me. Okay, great. There was equal thoracic expansion bilaterally. I'm going to have you turn back this way, and I'm going to assess for cardiac sounds. And I'm going to do this with the diaphragm of my stethoscope. All right, I heard S1 and S2, there were no gallops, no heaves or lifts. Everything sounded normal. And now I'm going to auscultate the apical pulse for a full minute. The patient's apical pulse was 68, which falls within the normal range. Now I'm going to go ahead and listen with the bell of my stethoscope for any murmurs in her heart sounds. So I need you to just breathe normally. Okay, there were no murmurs, so that's good. Now I'm going to have my patient lie back. I'm going to go ahead and check the abdomen. So everything looks symmetrical. I'm going to go ahead and feel the ribs. They're sloped at a 45-degree angle, and the costal angle looks to be 90. There's no visible pulsations or anything like that. So I'm going to go ahead and I'm going to listen to your bowel sounds. I'm going to start at the right lower quadrant. Okay, her bowel sounds were normoactive, which means that they occur every 5 to 15 seconds. And if I didn't hear any bowel sounds, I would listen in each quadrant for 1 full minute. Since there's no pulsations, I really don't think that there's going to be any vascular sounds in her abdomen, but I'm going to go ahead and listen with the bell of my stethoscope for any vascular sounds. Okay, there were no vascular sounds in her abdomen, which is great because that would be abnormal. Her AP to L is 1 to 2, which is also normal. Now I'm going to palpate your stomach, and if you feel any pain or tenderness, just let me know, okay? I'm feeling for any masses, any lumps. Feel anything? Okay, great. All right, you can fix your shirt. Okay, so her abdomen is all good. Now I'm going to keep you laid down, and I'm going to do the Homan sign, okay? What I'm going to do is flex your foot. I'm going to dorsiflex it, and if you feel any pain, you let me know, all right?
Okay.
Pain?
No.
Pain?
No.
All right, so she has a negative Homan sign, which is good. I'm going to have you sit up, and we're going to start testing your peripheral. Yeah, you can take your shoes off. Is it okay if you take your socks off too? Mm-hmm. Thank you. And have you roll your pants legs up and your arm, your sleeves. I'm going to assess the temperature of her skin. It's the same throughout. Her skin color is appropriate for race. I'm going to go ahead and look for edema. She has no edema that I can see. I'm going to check skin turgor, and it goes right back, which means that she's well hydrated. And now I'm going to go ahead and look at her fingernails. They're even and roundly shaped. They're slightly pink. The nail bed degree looks to be about 160, which is normal. I'm going to go ahead and check capillary refill. Okay, less than 2 seconds in the fingers and in the toes. That's great. So now I'm going to test your grip strength. Go ahead and squeeze my fingers. Okay, the patient's grip strength is 5 out of 5. Now I'm going to check your pulses. Your radial pulse is equal bilaterally, 2+. I'm going to check the popliteal. Equal bilaterally, 2+. Now I'm going to check the posterior tibial pulse. Is equal bilaterally with the 2+. And now I'm going to check the dorsalis pedis, which is equal bilaterally and 2+. Okay, now we're going to check for sensation, okay? And I'm just going to show you, this is going to feel dull. This is going to be sharp, and this is going to be dull, okay? You just let me know when you feel it. Close your eyes and just talk to me, okay?
Sharp, dull, sharp, dull, dull, sharp, dull.
Okay. Keep your eyes closed, and I'm just going to pick your foot up. Let me know when you feel this, okay?
I feel it.
Okay.
I feel it.
Okay, great. So the patient has sensation in her limbs. All right, now I'm going to have you stand up. Yeah, you can fix this. I'm going to have you walk to that door for me. I'm going to assess her gait. Now walk back heel to toe for me. Okay, great. So the patient's gait looks perfectly normal. She's got balance and coordination, which is great. She's not falling all over the place. Now I want you to stand with your feet together, arms by your sides, eyes closed. Okay, you can open them. She did great. That was a negative Romberg test. She kept her balance. So now we're going to do range of motion. I want you to follow me. Tilt your head to your chest, up, push your arms up, down, circles, lift your leg, do circles, other leg, do some circles. Okay, great. So this patient has full range of motion, and she comprehended and understood everything that I was saying to her. She was very cooperative, and she had a great head-to-toe assessment. There was nothing I could find wrong with her. So this concludes our head-to-toe assessment today.